Dr. Clarian Lannom. I was born and raised in Clovis, New Mexico. Just prior to my freshman year in high school, we moved to Corpus Christi, Texas. I lived on North Padre Island. I played soccer all 4 years, and I graduated from Flower Bluff High School. I have so many memories from the 4 years I lived there. I met many wonderful friends, and I'm still friends today with them. I went to college at the University of Texas at Austin, and I played soccer there my freshman year. My junior year, I found a program at the University of Houston. It's the entrepreneurship program. I applied and I was accepted, and so I transferred and finished out my college career there with a degree in both entrepreneurship, fell under marketing, and also a degree in Spanish. After college, I worked for an energy company. I started as an entry-level accountant and then was recruited into the energy sector, where I basically learned all about deregulated energy. I had a really good career. You know, I was rising to the top. So I was pregnant with my son, and I had an accident, and I realized that I was working these crazy hours, and I loved my job, but I loved it too much. And that was the problem, that I wasn't spending time where I should have been. My priorities were messed up. You know, I had to choose family over career. You know, ultimately it came down to my sister and I she was at a crossroads. She was in dental hygiene, and I was looking, you know, for a different career path. And we both went to visit Dad and saw his office, saw how happy he was, how fulfilled his life was, and that's when we realized what we wanted to do, and we were going to do it together. And that was kind of the turning point, that we decided to do it together. One of the great things I love about practicing dentistry is that I get to practice with my dad, who's an orthodontist, my sister, who's an orthodontist, and my niece, who's a dentist. And it's a lot of fun. We get a lot of cases, we get to bounce ideas back and forth, and it's just generally, I have a good time. You know, I learned so much from my dad and my sister and even my niece, and that's a lot of fun. Patients are often surprised that I can speak Spanish, and I really enjoy speaking Spanish. I studied a year abroad in Spain at the University of Salamanca, and it was a great experience, and it's just a lot of fun to practice my Spanish at work. Dentistry has had so many technological advances over the last 30 years, as in every field, and it's a challenge to keep up with all of those changes. I think the best way to do it, for me, what I do is I do continuing education courses. I obviously read journals to stay up to date on all the new advances, and then really when reps are presenting new products and stuff like that, I have to research. It comes down to doing my due diligence and making sure that the products that I'm using on my patients are the best out there. Recently I had a patient that she came in with several interior or front teeth breaking down, and to the point that they're no longer restorable. And you know, when patients present with their front teeth, you know, missing or broken down, they want it fixed immediately, and that, you know, that poses a challenge, because, you know, in her case, the most ideal treatment would be to extract the front teeth and place implants, and that takes time. It's really finding that balance, because you have to give the patient several treatment options, and although I think one is the most, you know, the recommended one, the most ideal outcome, you know, patients, you know, whether it's their budget or for whatever reason, they choose another option, and it's just really trying to work out that balance. And in the end, we found an alternative treatment option, and it ended up being wonderful. She loved it. She walked out, she told her husband, she was smiling from ear to ear. She's told everyone about it. She's a walking billboard for me now, and that's great. The recommended treatment plan, the ideal treatment plan would have been to extract and prepare it for an implant-supported bridge. We ended up extracting the teeth, and I was concerned that the teeth, the abutment teeth, which are the implant-supported teeth, wouldn't be strong enough, so we extended it to the bridge to include 2 more teeth. And that was after consultation with another dentist, and making sure that it would be a valid option for her. I believe strongly in educating patients so that they can make their decisions for their oral care. I don't want to tell patients what to do. I want to educate them so that they feel that they have a say in the treatment that they receive. People generally don't want to come to the dentist because either they think it's going to be painful, they fear the dentist, or financial reasons. It's usually one of those 3 things. And the thing is that for the financial aspect, it costs more if you don't go to the dentist on a regular basis. Prevention is key, and that's really right now the move in dentistry is to do the prevention, like educate patients and get them in for their 6-month recall visits and everything. Get them seeing a dentist because it's less expensive to fix something when it's small than when it's big and you're in pain. A patient should floss every night, preferably at night, just because the most important time to brush is also at nighttime. Most people don't know that. Most people don't brush at nighttime, but that's the most important time to brush. Your salivary glands kind of shut down when you're sleeping, and so if you have any food left or plaque left on your teeth, it just feeds that bacteria in there. I love it when patients come in every 6 months because it's a way for us to stay on track. We get generally once a year, we do radiographs and we check. It's the only way you can really check to make sure there isn't anything going on in between the teeth. And you get a cleaning. It's just a way for us to evaluate your gums and make sure that there's no bone loss. It's easier to fix things when they're small, and the only way that we're going to know is if we see you every 6 months. We have an awesome team at SmileLife. We have 2 great hygienists. I have great staff, and we really are all on the same page. We want to take care of our patients. So in dentistry, the general dentist is the quarterback, and every patient needs to have a dental home, and that's the general dentist. And the general dentist then, based on the patient's needs, will be referred out to the oral surgeon, the orthodontist, the periodontist, or the endodontist. And we work all together, making sure that the patient's dental needs are met. But it all comes back to the dentist to make sure that all of this happens. I feel like my duty as a dentist is to first and foremost listen to the patients, address their concerns, get them out of pain, and remove any infection. And the part I love most is really educating them so that they in turn can make great decisions regarding their oral health care.